Thanks, Bobby. Just a second, I'm sorry.
You're fine.
Okay, can everyone see okay? All right. Good afternoon, everyone. My name is Jennie Horner, and I'm the West Regional Coordinator for Ohio Family and Children First, covering 44 counties on the west side of the state. And joining me today is my counterpart, Aimee Matusik, the East Regional Coordinator, covering 44 counties on the east side of the state. We're also excited to share that we now have a newly named director, and her name is Elisha Cangelosi. She wasn't able to join us today, but I'm sure you may see her pop in these future ECHO presentations. Today, we were asked to review the actual referral process of ECHO. For those of you that have only listened in and you've never really submitted a case presentation. So we'll start through for the referral itself. As you already know, the referral form itself is the first step of ECHO, and it's for the county team to complete the required referral form. The referral form can easily be downloaded at www.wraparoundohio.org's website, and it's found under the Project ECHO tab. It's required that all referral forms only be submitted by County Family and Children First councils only. And all 88 counties in Ohio currently have a Family and Children First Council as written in the Ohio Revised Code. This ensures a multi-system care of approach, and it requires Family and Children First to submit the referral form to ensure that approach is in place. Family and Children First, or as FCFCs, as I might refer to it throughout this presentation, is a partnership of governmental agencies and community organizations committed to improving the well-being of children and families. Each county FCFC has mandated members that come together and meet for the common cause of the youth. Ohio Family and Children First Cabinet Council was created in statute in 1993 with the specific purpose to help families seeking governmental services by streamlining and coordinating existing services for families seeking assistance for their children. So each county Family and Children First consists of required mandated members, which include Children's Services, Job and Family Services, Board of Developmental Disabilities, their local mental health board, their education partners, early intervention partners, their general health district and or their city health district for those that apply that have both, at least 3 parent representatives and a nonprofit agency representative and others. So it's a unique system, multi-system care approach that already exists in each county. And then each county FCFC is also mandated to have their own service coordination mechanism. And this mechanism is a plan that the county team follows in providing service coordination to families. It must include certain areas, including a broad array of services and supports that are available in the community, an individualized plan for each youth served, a least restrictive environment, a coordinated effort at both the system level and the services level, a plan that is family driven and youth guided, and one that emphasizes early identification and early intervention. So the next step is the submission of the referral form. Once the referral form is actually completed, the form is submitted to their regional Ohio Family and Children First coordinator, which is Aimee and myself, depending on where the county is located in the state. And once it's received, the form is then reviewed by us to ensure that nothing's left empty, as well as to ensure that there's no identifying markers that are reflected on that form. This is an example of the referral form itself, which you can find and download on the website. Important data is collected at the time of referral, including all of the team's contact information that will be participating in the presentation, as well as the age and gender, race and ethnicity of the youth, the diagnosis, medications, system involvement, school placement, family and household members, as well as priority concerns and needs, barriers, and strengths of that particular youth. And then the form is then triaged to the ECHO team for review, as well as our office lets the county know of the date the case will be presented, along with the facilitator's name that will be contacting them for that review. The next step then is the actual ECHO to be scheduled. And once the date of that presentation is scheduled, a member of the Center of Innovative Practice team and facilitator will contact the local team to complete a review call. And these typically occur 1 week before the case presentation to the full panel, so that the county feels comfortable with the whole process and knows what's expected of them. During the review of this call, the facilitator assigned to the review will review these kinds of key information from the county team, which includes the timeline of the events that have occurred, the diagnosis, any interventions that have already been tried, as well as they'll gather any expectations from the local team of what they want to get out of the process. During this review call, the facilitator then reviews the timeline that events. I'm sorry, I already did that. The team now has the opportunity to share the case with the panel of experts. And you'll see here that last state fiscal year, 35 cases were presented to the ECHO team during that fiscal year. And of those 35, 22 different teams actually made presentations, which is a pretty impressive. And then the final step is the follow-up of the whole process. And at the end of each presentation, the ECHO panel of experts provide verbal recommendations of all the interventions that they're recommending. And then the Center of Innovative Practice and the team also then follows up with written recommendations. Here's an example of a county that received 4 pages of written recommendations made from the panel of experts. The expectation is then that the county team follows up on these recommendations. And then our Ohio FCFC office collects data on the overall process. Here's some feedback that we received from counties regarding the overall process that you can read. We've gotten a lot of feedback that they're very appreciative that this is a free service to them, that it's easily accessible, and that also that counties can call in and listen even when they're not presenting a case, that they can learn from the process of other youth that they're working with. That's the process in general. Aimee, did you want to add anything, or do any of you have questions for us?
I would just add that there are times, especially when the echoes have come in and we've asked that they be triaged. When we triage them, sometimes they get moved up to the front of the line just a little bit, just depending on the severity of what's happening. And we will follow up with the county prior or after they've received their recommendations, just to walk through what does that look like. Because oftentimes, I mean, there's 4 pages or more. I know of a county that received 9 pages of recommendations, written recommendations. And while we understand that it's not feasible that every county can follow through with every recommendation, it's just important that we go through, review what has been made available, what is feasible for the county to do. And then we also have suggested that those teams present some of the recommendations, even if they're not feasible, have those conversations with your councils to say, hey, well, we don't have this service here now. What can we do and how can we move forward to possibly bring that service to our community? I know IHBT is a big service it's not readily available, and I have Southeast Ohio, so it's their service poor oftentimes. So it's, you know, kind of having those conversations about, well, we can't do all of these things. What can we do? And how can we move forward with some of the others? Are there any other questions? Or are there any questions?
Yeah, please, if there are questions, we do have just a couple of minutes here.